Hi, everyone. I'm Dr. Jennifer V. Brown, your stroke specialist, and I'm aging gracefully with a stroke diagnosis due to sickle cell disease. Today, we're going to discuss some ideas to get foot clearance after stroke when an ankle foot orthosis is not available. So, it's imperative that we secure the foot in order to start early gait training. And depending on the impairment, tone, spasticity, weakness of the lower extremity, do different things. I've walked people in a serial cast to help for tone management and stretching out the heel cord. I've had a rocker bottom so it's easy to get the body weight from behind the ankle to in front of it. Make sure that the height of the shoe, you've added a layer of a sole so that you can have an even pelvis with the use of a serial cast. I use ACE bandage. I find that the friction there, it gets caught, especially if you can't help the person bend the knee and or they don't have if they have inadequate hip strength to get that leg forward. I use a stockinette just to help glide over the floor if they have some hip and knee flexion. Also, right before swing phase, I add a little resistance with a quick stretch, and that seems to get a triple flexion response, and the foot will come up and it can just easy glide across the floor. If the person has a proprioceptive problem and I need to load that leg in swing phase so that they can get the feeling of what flexion is like, then I use a skate. Make sure you add a phone book, a step stool, something the same height as the skate so that the pelvis can be at the same height on both sides. In order to keep the foot on the skate, I use a non-skid material or I just use a Velcro loop and sticky side and I put it on there so that the foot can stay on the skate. I use foot sliders, and there's one from Kinematic Concepts you can look, or you can just go to a carpet store in your vicinity and see if they have carpet skates. I really like these because you don't have to worry about hip or knee flexion. You can do all the work from the pelvis rotating and just let the legs slide forward. I really am using a lot more foot sliders early on. So we have some other options. I use elastic bands of different tensions based on the weakness, tone, or spasticity in the compartment muscles, particularly the posterior and the lateral compartments. And this is evidence in practice on the uses on how to tie the TheraBand to control knee and ankle and foot movement. I use rigid taping when there's proprioception and greater weakness, but I use kinesio taping when there is movement, they're unable to sustain it over time. The questions you really have to ask and the option to choose are many. But first of all, is there contracture at the talocrural joint causing the foot drop? Because if there is, none of these items will work, with the exception of the serial cast. But then you have to add on a rocker bottom, and you got to make sure the shoe on the opposite side has some added sole height so that you can have an even pelvis. Is there tone in the posterior calf muscles causing foot drop or the posterior tibialis causing foot drop with inversion? And think about tonus in the lateral compartment or just inability to generate force to help with the dorsiflexion, because if you do have the anterior tib turn on, you don't want it solely pulling into inversion as it comes up. Is there proximal, volitional, isolated movement, or synergistic pattern movement? Because how and what you use distally at the ankle determines what's going on proximally. You may start to see some compensations. And then how is swing phase of the hemiplegic lower extremity occurring? Are they hiking their pelvis? Is there hip external rotation with an adduction movement? Or is there abduction with the external rotation. People tend to call that circumduction. So you have to consider the movement that is occurring, and that may often determine what you will do at the ankle and foot. Remember, I am your trusted source for all things ankle foot orthosis and stroke neurorehabilitation. These videos are posted on Tuesdays and Thursdays. Like, share, subscribe, and leave a comment. Thank you. And don't forget about these references. Remember, evidence-based practice. Apply what's there to optimize the interventions for your clients. Thank you so much for watching the video. Bye.